Members of Congress are renewing their efforts to prevent women from dying during pregnancies and childbirth. What's known as the Momma Act was reintroduced Tuesday. It calls for comprehensive reform to pregnancy delivery, as well as maternal and postpartum care. The measure was sparked in part by the increasing number of deaths due to childbirth. It lays out that the rise, quote, is predominantly driven by the disproportionately high rates of African-American maternal mortality, adding, it's one of the greatest and most disconcerting racial disparities in public health. The bill was introduced by Democratic Congresswoman Robin Kelly from Illinois. She joins me now from Capitol Hill, along with Dr. Lisa Hollier. She's the president of the American College of Obstetricians and Gynecologists and called for congressional action on the issue. Thank you both for being with us. Such an important issue. Congresswoman, let me begin with you. You reintroduced the Momma Act Tuesday. What does the measure entail?
Well, it's 5 prongs to it. First of all, collecting data. Secondly, developing review committees, because we found when there are review committees, the incidences go down. For example, in Philadelphia, they established a review committee, and the incidence maternal mortality went down 75%. Also, cultural competency. There have been many studies that you tend to do better when the person treating you looks like you, but we need cultural competency throughout the continuum of care. Also expanding Medicaid coverage from the 2 months to a year, because according to what we've learned from Dr. Hollier and her profession, that incidences happen later than 2 months. Sometimes it's not always within the first 2 months. So we want to make sure that the care for women that just had babies are covered through the first year.
And the bill lays out that it's more dangerous to have a baby today than it was 25 years ago. Dr. Hollier, what's happened here?
We have seen a significant increase in the rate of maternal mortality in our country. In fact, the United States is the only developed nation with a rising maternal mortality rate. Every year, approximately 700 women die in the United States from pregnancy-related causes. We've seen significant rates of maternal mortality from problems like bleeding, high blood pressure, infection, and one cause that has been consistently rising is maternal mortality due to heart disease.
Well, according to the Centers for Disease Control and Prevention, the maternal mortality rate varies drastically when it comes to race. African-American mothers are 3 to 4 times more likely to die than white mothers. Dr. Hollier, what are the biggest hurdles to combating this disparity?
I think that the Momma Act is a significant step forward in combating the disparity that we see for our African-American mothers. I believe the provisions of the Momma Act, and I'm so grateful to Representative Kelly for reintroducing this legislation, will really help us as providers do a better job meeting the needs of all of our patients. We've heard how important it is to understand our biases so that we can address them. We also know how incredibly important it is as providers to actively listen to our patients. And in doing those things, including getting better data and understanding the problem at a detailed level, implementing consistent protocols for all women. In doing those things, we know that we can reduce this disparity, in fact, eliminate the disparity in maternal mortality.
And Doctor, I've read a little bit about this issue, but I think most people aren't familiar. When you talk about sort of systemic biases and how those manifest themselves in actual treatment, can you just explain a little bit how it is that those kinds of biases actually affect the very care and quality of care that women receive based on their race?
There is some research, particularly in the field of cardiology, that has demonstrated that African-American patients do in fact get different care than patients who are Caucasian. They are less likely to be offered specific types of treatment, for example, and those types of biases are the very things that we're trying so hard to address.
All right, Dr. Lisa Hollier, thank you very much for your insight. And Congresswoman, I'd like to ask you about some other news of the day. House Speaker Nancy Pelosi said Monday evening that she is against impeaching the president, and I'd like to play some of that now.
What I'm saying is, from our standpoint, our day-to-day work is not about him. It's about the American people. I just don't believe in it. They wanted me to impeach President Bush for the Iraq War. I didn't believe in it then. I don't believe in it now. It divides the country unless there's some conclusive evidence that takes us to that place.
Congresswoman, you serve on the House Oversight Committee, which is investigating a lot of the matters tied to potential impeachment. Have you heard enough to say that impeachment should be off the table?
I tend to agree with Speaker Pelosi that we need to continue on with the investigations. We need to hear from Special Counsel Mueller, and depending on what he says, make our decision. But I think by the time we hear from him, and if we moved forward on impeachment, the 2020 elections will be here. So I tend to align myself with Speaker Pelosi, as that let's just move on, let's get our work done, let's move the country forward, and looking forward to 2020.
Well, the president's former attorney, Michael Cohen, testified before your committee last month. But who else close to the president do you want to see appear? And would you want to hear, for instance, from his family members?
I have no problem with hearing from his family members. I know usually family members tend to be off limits, but his family members are very involved in his presidency. They appear to be some of his senior advisors. So if we are going to investigate how they receive their security clearances, then yes, I think they should be investigated. We need to act like statesmen and stateswomen, not be petty, but just getting the facts of what happened.
How mindful are you of what some say could be the potential for overreach by Democrats as they continue their investigations?
Well, we have to concentrate on the facts. We have to concentrate on not overreaching, no theater, no drama, just getting to the facts. There really has been nothing done, in oversight in the last 2 years. So it may seem sometimes like overreach, but it's almost like making up for what hasn't been done in the last 2 years.
I'd also like to ask you about the president's budget proposal. He asked for an additional $8.6 billion for a border wall. Do you think that demand could prompt another government shutdown?
I don't even want to think about there being another government shutdown, and I don't think my colleagues on the other side want to think about another government shutdown either. Enough damage was done, enough families were hurt with the government shutdown that we had. So I think that we will do everything we can to ensure that there's not another one. But I also don't think he's getting 8.6 either.
How much do you think he might get?
Well, we talked about, there were different offerings. I'm really not sure. We have to see, what we can negotiate. But it seems hard to negotiate with him because the ball keeps changing. So we'll see.
All right. Illinois Congresswoman Robin Kelly. Congresswoman, thanks very much for your time. Really appreciate it.
Thank you.